There we go. Okay, we are live. Hello, everybody. Good afternoon. Welcome to Stigma-Free Society's Facebook Live. Super happy to have you all join us. I'm just going to here we go. Why don't I boost this right now? Perfect. And as we see, we have people coming on. Really happy to see everyone here. So we have a great chat happening today. It's going to be with Christian Filice, and I think you'll really enjoy the conversation. I just want to do a quick disclaimer that in this video, we're going to talk about how COVID-19 is impacting our lives. Some people are enjoying staying home, while others are having difficulty staying inside and really everything in between. So as you know, as we transition into this new territory, we appreciate that you're here joining us, but if you feel that you're at risk or in crisis regarding your mental health, please just know to stop watching, call 911 so that our amazing first responders can do their jobs. Okay, so good afternoon. My name is Nisha. I'm a registered clinical counselor. I have a background in teaching, and I've worked at Intake at the Ministry of Children and Family Development. I own a media company called Human Biography. We specialize in documentaries and social media commercials, and we're all about storytelling. And I'm hosting this series, Wellness Chats with Nisha, every Thursday at 2 p.m. for the Stigma-Free Society. So if you feel that someone would benefit from this, please feel free to share this link. We would love to have as many people benefit from this as possible. So thank you, everyone. I would love to introduce our guest today as I bring him up here. Here is Christian. Hi, Christian. Welcome.
Hey, how's it going?
Amazing. We are excited to talk with you. So I'm going to give a quick bio about Christian, but why am I even saying quick? This is an amazing bio. I'm not going to rush it. Okay. So these are some of the cool things that Christian is involved in. He's a school community presenter for the Stigma-Free Society and also an advocate for social justice. He's enrolled in the Doctor of Psychology and Clinical Psychology program at Adler University. So Christian graduated from McGill in 2015 and wanted to help out youth risk understand mental health and how to face barriers. So he's worked in a variety of settings. So lots of years of camp counseling, high performance coaching, competitive and volleyball, educational assessment of learning disabilities, ADHD, intellectual disability, and mood and anxiety disorders. He's currently placed at the Child and Youth Mental Health in White Rock for his academic year, and he lives with post-traumatic stress disorder, so complex, so CPTSD, and that stems from early childhood, which generated multiple addictions from which he's recovered. Amazing. And in addition, Christian identifies as a queer male, and through his experiences, he's truly understood the impact that stigma can have on individuals from different societies other than the mainstream, and his work includes advocacy for sex workers' rights and visibility and tackling the stigma of disabilities and addiction. And he's completing a graduate research project on the stigma of mental disorders specifically. So welcome, Christian. I love that you're an academic. I've really been into academics my whole life. And I'm really interested to know what got you interested in your graduate as well as postgraduate work. It's very, it's all encompassing in many different areas.
Yeah, I would say I was kind of prescribed to be a doctor from a very young age. That's kind of the family. It's very much a healthcare family that I grew up in. And when I got to university at McGill, I saw the kids who were preparing for medical school, and I realized pretty quickly that I was not going to be able to achieve the kind of grades that they were getting and living the lifestyle that they were. Because of my mental health challenges. So I went into psychology to understand some of the dynamics that occurred in my family and have a better understanding of the impact on me and also the impact on them. and that kind of just led to this journey of eventually going into clinical psychology and deciding to become a psychologist, with a specific focus around obviously the kind of mental health that I've experienced and that runs in my family, which is a lot related to trauma, emotion dysregulation. My father's side of the family, there's a lot of generational transmission of trauma, and so as much as that's been really difficult, I'm actually very grateful that the transmission has kind of gotten to a point where I'm able to actually kind of break the cycle, because I feel like it's this pattern that really we've had to fight against as a family. And for a long time, we were fighting against each other until we were really able to identify that this is a pattern. It's happened in most of the parent-child relationships throughout the generations. Yeah.
I absolutely love that. And I don't know, like I studied that in my master's as well. And it was very eye-opening for me to see that there are so many family examples, like, even like the Kennedys in the US, like generational trauma or death, and the Clintons, like in every family, there are patterns that people experience, yet if we don't pay attention to those patterns, how do we ever know how to change them? So love that you said that. And I hope that even those watching would understand that we all have these generational patterns that can be identified and then changed. Can you tell us a bit about that? Like, what would someone do how would people go about looking at that in order to be aware so that it doesn't keep impacting everyone?
That is such a tough question, and there's no short-term fix to that.
Yeah.
One thing is to get in touch with your needs, take care of your own mental health first. I went into psychology, I went into clinical psychology, with the dream of healing my family, as many people do, and helping others has always been a way that I've distracted from kind of, looking at my own back door or backyard.
Yeah.
And finally coming to terms with that healing myself was going to be the best way to go about that. And once I, started engaging in therapy, got into recovery, dealt with some of my addiction issues, what then became, it's an ongoing work, but through kind of getting in touch with my needs and my boundaries, and with trauma specifically, especially trauma in the context of attachment or family relationships, the work really becomes around setting boundaries and respecting your own boundaries. It's not just setting them, but you have to really live by them. And it's similar to living in line with your values. And at the same time, having to play that role of an educator for my family, and modeling it for them and showing them how to do that, because none of us were taught it. None of us learned how, and my parents did a phenomenal job of putting my brother and I in extracurriculars and, providing additional academic opportunities for us and supporting us in so many ways. But they were not able to transmit learnings that they never had. And so I had to go out and seek that for myself through mental health counseling and therapy, through recovery programs, and eventually kind of pass that knowledge back to them, which is a slow process because, when you have this relationship that's existed in one way for probably 24 years before I started to really shift it, the patterns are pretty crystallized. That doesn't mean that they're concrete, but they're pretty crystallized. And so it does take a lot of work, and it's pretty challenging stuff. In the beginning, what I received a lot was, "You're so selfish. I can't believe you're being so selfish. I can't believe you're treating us like this." And now I'm receiving messages like, "Thank you so much. Thank you so much for being committed to your wellness. Thank you so much for showing us how. And thank you so much for being patient and kind." And it's really rewarding, and it helps me accept the difficult past experiences that led us to this place, but also those challenging experiences that came along with me starting to get better, because it wasn't just like, okay, now we're on the rainbow road to recovery, everything's hunky-dory. Yeah. It was like, okay, now we're faced with a whole new set of challenges once I start to look after myself.
Yes. And maybe you could take us down that road of, your personal journey with mental health, starting from childhood, and like maybe when did you start noticing things or signs, and how did everything develop?
Yeah, so this is something that in my conversations with Andrea, the president of the Stigma-Free Society,
Amazing.
uh, it's a lot of, it's quite difficult for me to focus on my experiences and not my brother's. The challenge being that in the family that I grew up in, he was kind of what we sometimes call in mental health the identified patient, which is basically like the person in the family who is perceived to be sick or ill. And so his mental health issues started pretty young, and mine kind of took a back seat. Although mental health and mental illness is like so prominent in my family, different forms of mental illness have different amounts of genetic composition. And so the one with the highest degree of genetic transmission is actually bipolar disorders. And so I have people diagnosed with bipolar disorders on both sides of my family.
Mhm.
So lots of mood instability, lots of emotion dysregulation. That's always been an issue.
Mm.
My dad and my brother, lots of anger. I was kind of the recipient of a lot of anger. And yeah, kind of the smallest, weakest, I'm the younger. So the smallest, weakest one, when both of them were having issues controlling other aspects of their life, difficult relationships, difficult work situations. I was kind of this like small little weak thing that they could exert their control over, which was psychologically very damaging over time. And never really felt like I had a lot of safety or security, although my mom and I were pretty close, which was kind of a saving grace. But unfortunately, then as we kind of went into adolescence, my brother started to struggle a bit more, and particularly with chronic suicidality.
Yeah.
And so, going back into that idea of the identified patient, like I responded to his mental health crises, which were kind of recurring pretty regularly, and the impact on my family by really feeling as though I had to be this perfect child. I wasn't allowed to have an emotion or a problem or an issue because I felt like I had to do everything I could so that my parents had as much free time to manage my brother's health and try to support him to get treatment. And at the same time, my parents have their own mental health issues, which were kind of unacknowledged at the time. And so there were some pretty difficult experiences in there where the first time that I found out that my brother was had tried to take his own life, or was my mom kind of telling me she got an emergency phone call while she was driving me to school, and she pulled over and kicked me out of the car and said, "I don't even know if your brother's alive or dead right now, and I can't deal with you." And so she was trying to protect me, and it breaks my heart. And her and I have worked through this, and she knows that I love her and that I understand that she was trying to protect me. That moment, I felt so abandoned, and it wasn't just that being left there. It was also then that was the first time I found out that my brother might take his own life. So felt worthless and rejected, and also so afraid that someone that I loved would be taken from me. And that was one of the worst days of my life. And when I went home, there was just so much chaos in the aftermath of this that, no one even ever really came to ask me if I was okay. And I felt like I had to hide and be away just to give them as much space as possible. And that kind of continued for about, 5 years until I left home. Where there was lots of other stuff going on, some, witnessing some domestic violence and, lots of stuff that was really damaging for a kid. And, I kind of invalidate myself a lot when I think about my trauma, because I'm like, well, other people have had much worse. And that's something that's really damaging pattern for us with mental illness to do, is to think about it in that terms, because you can't really compare things like that. Someone with an amazingly supportive family and all these super great relationships could go through something devastating and not be traumatized. And someone who objectively, emotionally felt like I didn't even have parents at that time. They weren't accessible to me. I went through some experiences that are pretty challenging for an individual to process in the absence of a parent figure. And that were ongoing. It wasn't an isolated event. It was something that occurred for 5 years. of my life. And actually, the fear for my brother's life is something I've experienced every single day since that day. And it's a pretty challenging, big emotion to live with.
Those are some very deep emotions, and thank you for sharing that with us, because I think this is a really important example that trauma, you can't measure the scale of trauma. It's whatever somebody experiences within themselves. And so whatever that trauma is, it's how you interpret it, how you feel, exactly like you said. What is the family support around that trauma? Does the trauma continue, or is it addressed at that time? And I think it's important for those watching, for all of us to consider that, you know, as we have children at home, I have an 8 and a 5-year-old, that I've really been paying attention as we've been in, like, what are the things that I'm reacting to? How am I responding to my children? Is this like, what is the escalation level for me? And also, what work do I need to do? Because if we're having, like, you know, children that have things going on and they have their own emotional experiences, how I respond to them is based on my childhood trauma.
Yeah.
Based
So
on what-
there's a quote that I want to share, and I can't remember who it's by. I posted it on my social media recently.
Yeah.
And it's that trauma is not what we experience, it's what we carry with us in the absence of an empathic witness.
Ooh,
and I think it is
good.
so poignant and beautiful, because what you're talking about is really, really so beautiful, right? Because you're acknowledging that children have their own emotional experiences. And when they start to experience big emotions like they might be having around the fact that we're having a pandemic and lots of unprecedented events are occurring, what can be processed, what can be held, what can be witnessed empathically, is what people can be doing to support children in that time. And so what you're talking about, your own reactions to things, what's coming up, I can kind of think of those as like, what are the barriers? What's getting in the way for me to be that empathic witness? Because, you know, when we're in a place of grounded, calm, you know, tranquility, it's quite, it can be easier to respond in that way. Some people were never taught those skills, so they can't do it even if they're feeling calm. And that's real as well. But for those of us who have those skills, it's not always easy to implement them, and our reactions and what's coming up and those experiences we've had, that's kind of those barriers, and how is it that we can address those barriers, take care of our own needs, so that we can then be there for each other in the way that we need
to be able to support each other and understand we're all going through different things at different times. You know, I feel that, you know, we all have different examples or levels of our mental health. And maybe you could tell us a bit about your experience with diagnosis.
Yeah, so it's funny, actually. I forgot until you said my bio that there's been an update with my diagnostic status. So, yeah, which is, you know, it can be a long, my first thing is it can be a long journey. You know, we have these categories in mental health because they're the things we see most commonly. But it's widely acknowledged by the entire mental health community that, you know, people don't fit in boxes all the time. And what do they say? You know, a single diagnosis is the exception rather than the rule.
Oh, yeah. Dual diagnosis, I think, is actually way more common, right?
Yeah, totally. So, you know, I originally, given the family history, started out going to counseling, and I was like, okay, I think I have a bipolar disorder. That's what it seems like. And at the time I was using substances heavily, and, you know, medical professionals are very unwilling to diagnose someone who's actively using substances because psychoactive substances really change your mental functioning in a dramatic way. So it's important to go through a period of sobriety before you can get an accurate picture of what's going on. So I had this idea that it was probably a bipolar disorder, but it wasn't until, you know, I got sober when I moved to Vancouver for grad school, that I was really able to kind of start to look at that more clearly, and entered therapy for a few years. And at the outset of therapy, you know, we were looking at this as a complex PTSD, which is really stems from, you know, repetitive, ongoing, long-term experiences of trauma. So, for example, being having a sibling or a parent with severe mental health issues that basically, you know, it happens for you know, the entirety of your relationship with them, or domestic violence situations that occur for a long time. And so, it's always been clear that it's a trauma disorder. What it is specifically came to kind of light over 2 years of therapy, where I was struggling to make the changes that I wanted to make in my life, and thought that just kind of revisiting some of those experiences should speed the process up. But that wasn't what was happening. So I was getting really frustrated. And eventually, I studied clinical psychology for 3 years now. And I know a lot of people may go online and they may diagnose themselves, but I actually went to my psychologist and said, hey, I think we need to revisit the diagnosis. And I think this is actually more accurate. And he was like, yeah, I think so too. And so what it came out is that it's more of a personality disorder, and it's a stigmatizing label, and it's quite negative. And
wording alone is difficult, right?
Yeah, like something's wrong with your personality. It's like something's wrong with you, period. Everything about you is wrong. And
that's the stigma in itself, right? That you're like, that's, if you explain to someone, it probably would even create a hesitancy to want to share, just because of the way that it's worded.
Yeah, I was having a lot of difficulty deciding about whether I was going to share it today with people in my life, like, generally speaking, with my family and stuff. And I've kind of gotten to the point where, and after some conversations with one of my professors, this label, we all kind of acknowledge it's a bad label. Lots of mental health professionals don't agree with these labels, but they're what we have. And it's much better to understand personality disorder in the context of a complex disorder. Yes. And when we're looking at personality disorder, all we're saying is that there's more entrenched patterns. Things are more difficult. And it's typically, personality is, there's some heritability to it. So it's typically going to be in the people around you. It's what was modeled for you. It's what's constantly reinforced in a lot of your family relationships, which can be what keeps those patterns stuck. So, when it's personality disorder, we're really just talking about something that may be more challenging to treat. It may respond to some treatments and not to others. And it may take a longer term treatment in general. And sobriety is particularly important when we're talking about a disorder like that, which is something that I've had to really, really come to terms with.
And I think that, what I see with even people around me, and when people have experiences in life that sometimes it's just easier to self-medicate, right? That's where I think sometimes—
Don't know it. For the short term, in the short term.
And that becomes, leads to addictions, and then people around can get confused of like, okay, well, it's hard, like you said, to necessarily diagnose and understand what's happening. How has, maybe self-stigma impacted you, or even stigma on a systemic level impacted you?
Yeah, so having to deal with a substance use disorder, which, from the perspective of acceptance, inclusion, and focusing on not discriminating and not stigmatizing, a substance use disorder can be viewed the same way depression can be viewed, as a mental disability. And I know a lot of folks have a really hard time with that, and they see addiction as a choice, whereas from a psychological perspective, it's really not in most cases. And often people who are exposed to substances may not have any idea that they have been traumatized. I definitely went at 18, I was like, I'm good. There's nothing wrong. Like I have, the best grades in the high school. I was like, athlete of the year, did all these amazing things, student council. Like, how could there be something wrong with me? Yeah. And then, you realize, and there's these other things that are really insidious, and that they're really hard to notice and so subtle, like the fact that I really have a hard time saying no to things. So how was I to be prepared for what I would be exposed to, what would come into my life through different relationships, and how I'd be able to navigate that? So when you have all of this trauma and all of a sudden substances become something in your life, and even if it's, I struggle with like I have ADHD as well. So I struggle with impulsive behavior that I neurologically don't have control over. And so we're talking about the decision to begin engaging in substance, which may have been something that I didn't even want to do, really. I mean, I went to university saying that I was never going to touch drugs, and that changed really fast. And once it changed, it became something that was a life of its own, because there was this, this giant mountain of emotion that had, just was desperate to be processed, that was really consuming me, even though I didn't really know it.
Yeah.
To have a break, to have a break from spending every single day thinking that my brother was going to take his life, that was nice. It was nice. And there's other ways to go about it, but it was something that just happened.
I could imagine that sometimes we just all look for a way out, a way to quiet our minds, a way to stop all the emotions from running. And I think it's all connected, right? So I feel like from all your experiences in life, it's like we have different roads we travel down. And so you've gone down different roads, and now you're really on a road of helping people in these areas that you've experienced. And so maybe you could tell us a bit about the type of work you do that helps create social change around stigma.
Yeah, so there are definitely some different approaches to that. You mentioned my research project, which is going to be around the stigma of borderline personality disorder specifically.
Okay.
And so that's kind of a research academic way to tackle it. I'm looking at, how people in society view borderline personality disorder, and how does that attitude change, whether they think it's caused by genetics or whether they think it's caused by trauma, or whether they think it's a combination of both, and looking at whether they see a man or a woman or someone with a diverse gender identity having BPD, as it's called. And that's really relevant to me. It's really personal to me, and it's something that I think we really need to explore. And on the other hand, I also really like to do more active advocacy work, in the sense of, I do education around sex work with a lot of healthcare professionals. So that involves basically interacting with nurses who are providing these healthcare services to sex workers, some of whom are street-based, and others who are not, and just kind of educating them a little bit about the common experiences of individuals who are engaging in sex work, the range of previous encounters with healthcare professionals, and what stigma looks like in the context of those encounters, how trauma impacts that, so that we can really encourage sex workers to be able to feel comfortable and safe accessing healthcare, which is something that we all should have and feel comfortable doing, without fear of retribution or being abused or damaged in those kind of situations. So
It's actually very interesting. I used to volunteer with Wish Drop-In
oh
Center
yeah.
on Hastings and Gore. So that was all about supporting people in sex trade and making sure they have support,
You
medical.
you volunteered at Wish, you were at MCFD, like we gotta chat. We have
I know
a
that you've
overlap
done
here.
so many
Wow.
similar types
Yeah.
of work, and so like as you're saying these things, I have all these feelings come up around, there are so many populations out there, and really in the end we're all connected, like all these things that we're experiencing. Like, why were you and I drawn to this type of work? Because we felt these feelings, and we want to support people. And I also want to say to everyone out there that if you have feelings and you have experiences, and just know you're not alone, that this is not something just random. Many people do. And that's why we're talking about this today, because we don't talk about it enough. We don't share enough what we've experienced as our traumas, our anxiety, our depression. And mental health is nothing to be afraid of or ashamed of. It's in all of us. And
Yeah.
so be open and share, like, the work that you're doing is amazing.
Yeah, and when we're talking about stigma, when we're talking about discrimination and oppression, just to kind of think about what's going on in the world right now with the Black Lives Matter movement, obviously different forms of oppression are different. There's fundamental differences, but a lot of mechanisms are the same. And so in that sense, obviously us who live with mental illness want to advocate for it. And at the same time, discrimination comes from society as a whole. And so it is kind of the responsibility of everyone to open those conversations about mental health in the same way that it's the responsibility of everyone to open those conversations about racism. And they're not comfortable, they're not fun. I don't like to talk about how I feel stigmatized by friends or people in my life, in the same way that it's hard for me to express to people that I'm uncomfortable with racist attitudes. And at the same time, it's probably not as uncomfortable as it is, not probably, it's not as uncomfortable as it is for people who experience that discrimination and oppression. And so it is about the effort of me going out and doing that type of work, whether it's me advocating for mental health or anti-racist efforts. So, you know,
I love that.
there's a lot of work to be done when it comes to fighting oppression in our society.
I fully agree. And I think that if we can all come together and just see each other as humans with hearts, and that we all just need love, that we can talk about racism, we can talk about mental health, and then we can like connect with each other on a deeper level.
Yeah.
And then like that's what matters, right?
Yeah.
And the judgment of what's going on with this person, what's going on there, they're different than me. No, we're all the same. You know, we're all the same. And so I just want to like say thank you so much for the work that you're doing with the Stigma-Free Society, with all your work, and supporting so many different groups, you know, groups that need a voice. And so I think your voice is a beautiful voice to bring to that, and a strong voice. And so we're here to support you in any way that you need. And just want to say thanks for doing the work that you're doing. And it was a pleasure talking with you. This is my fellow Gemini. We both have birthdays.
Yeah.
So, like, there's a lot of connections here.
Totally.
So, Christian, thank you once again, and just appreciate it. And to everyone else watching as well today, just know that you have a voice and you can support people out there, and that you can also be supported. And just know that we're all, you know, it's all one love. So please share if you think this is important on your poor arm.
Yeah.
Please share if you think that people can benefit from this talk. And please join us next week as we will have more conversations about these important topics. So take care, Christian. Thank you again. And take care, everyone. Have a beautiful, beautiful day. As I end broadcast.